4 decades after it was first identified, HIV continues to affect millions of people worldwide. Although the world has made significant progress in recent decades, important targets for 2020 were not met. We are not on track to reach our Sustainable Development Goals by 2030 unless we change our approaches. Division, disparity, and disregard for human rights have all allowed HIV to become and remain a global health crisis. Now, COVID-19 is further increasing inequalities faced by people living with HIV, with low access to COVID-19 vaccines and many disruptions in HIV prevention, testing, treatment, and care. Children, adolescents, and men, and populations at high HIV risk, such as men who have sex with men, people who inject drugs, sex workers, transgender people, and people in prisons, are among those who are not able to access HIV testing, prevention, and care services. That's why WHO is calling on global leaders and citizens to rally to confront the inequalities that drive AIDS and to ensure everyone, everywhere, has access to HIV services. This means finding innovative ways to safely deliver person-centered HIV prevention, testing, treatment, and care services, ensuring that all groups of people at risk continue to obtain the services they need, ensuring access to better and safer medicines for children and pregnant and breastfeeding women, protecting, engaging, and supporting health workers to provide care that is kind, respectful of human rights, and without stigma. In short, it means renewing and revitalizing the global fight to end AIDS by 2030. We all have a role to play. Help us make this happen. 4 decades after it was first identified, HIV.
Well, good morning, good afternoon, and good evening. I'm Meg Doherty, Director of the Department of Global HIV, Hepatitis, and STIs here at WHO Headquarters Geneva. And I'm joined by Stuart Watson, Chair of UNAIDS Staff Association from Bangkok, as my co-moderator today. And we'd like to welcome you to our World AIDS Day commemoration. Over to you, Stuart.
Thanks very much, Meg. Well, it's my great pleasure to be joining you here today as the co-host of this global event. And as you said, I'm representing the staff of UNAIDS as the chair of the Global Staff Association of the organization. Let me just begin by giving us a few of the housekeeping issues before we begin. Now, we do have French and English translation available. You'll see at the bottom of your screen, if you're not familiar with the Zoom platform, a little globe. And if you click that, you can make your choice as to whether you prefer French or English translation. We'd love to hear from you throughout the event, so please enter your comments in the chat. You'll see that at the bottom of your screen as well. And during the Q&A period, we'll do our very best to respond live and during the discussions. Now, if you have any technical problems, any technical issues with your connection and participating, do let us know through the chat, and our IT team will do their best to help you out. So with those few things, Meg, I turn it back to you and to take us through today's agenda.
Thank you, Stuart. And let me quickly let you all know what we have planned today. We have a very packed agenda, but really a wonderful agenda where we'll be starting out with words from high-level speakers from WHO and also from UNAIDS, as this is a joint World AIDS Day commemoration, plus a screening of a new video and movie from Prince Harry, the Duke of Sussex, as well as interventions from the Ministries of Health of Thailand and Namibia. We will then move on to a panel after a singing celebration from the one who sings. And during the panel, we'll have an opportunity to hear from those populations and persons who may be left behind in the AIDS pandemic and in the AIDS response. And we will end up our evening or our afternoon with the lighting of the candle from our UN Plus member here joining us today. So with this, I would like you to invite you to go to the Zoom chat, introduce yourself, tell us where you're from. And if we have, I think at this point, it's going to be difficult for me to see who's in the chat, but we welcome all of you from around the world. And we know that we have many members joining from different parts of the world. So it's now my pleasure to introduce Dr. Tedros Adhanom Ghebreyesus, the WHO Director General, who is just coming off of a very historic special session of the World Health Assembly, where member states agreed to launch a process to develop a global accord on pandemic prevention, preparedness, and response. And I'm just so very proud to be able to ask Dr. Tedros to deliver his keynote message to our audience. Thank you.
Thank you, Meg. Because we have a senior person here, the Deputy Prime Minister, I would actually prefer if His Excellency could start and then do the opening, and then we follow him.
Thank you. That's fine. And we'll pass over to Stuart to introduce our Deputy Prime Minister. Stuart, over to you.
Thank you, Megan. Thank you, Dr. Tedros. Well, it's my great honor, in fact, to introduce His Excellency Kun Anuntin Charan Virakun, who is the Deputy Prime Minister of Thailand, where I'm joining this call from, and the Minister of Public Health in the Kingdom of Thailand. Thailand has a long and well-recognized, very successful history in the response to HIV. So it's a tremendous honor for us to welcome Thailand, who is also going to be taking up the chair of the UNAIDS Program Coordination Board at the next meeting coming up shortly. So, Excellency, please, we welcome you to give your thoughts on this important commemoration of 40 years of the global AIDS response. Deputy Prime Minister.
Thank you, Dr. Tedros, for giving me such an honor in taking precedence of the statement. I really appreciate it. Dr. Tedros Ghebreyesus, the WHO Director General, Ms. Julia Imin Chanduro, the Ambassador of Namibia, Chair of UNAIDS Program Coordinating Board, Ms. Winnie Bayanyima, Executive Director of UNAIDS. My dear colleagues and friends, it is such an honor for me to join the World AIDS Day 2021 today at UNAIDS office. We come today to foster our commitment in ending HIV/AIDS. Despite the remarkable progress in the global HIV response, challenges remain on the inequalities in access to health services and medicines within and across countries, gender, economic status, and age group. Young people are the future of the nations and the cornerstone of the global AIDS response. However, HIV continues to disproportionately affect them most, especially girls and women. Young people living with HIV often fall out of care due to self-stigma, social stigma, and discrimination. Eradicating all kinds of stigmatization must be our full global commitment with immediate actions. We believe that adolescents and young people living with HIV can be the agents for change by championing HIV prevention, treatment, and care among themselves. Many countries had established a network of youth living with HIV to strengthen their life skills and provide peer-to-peer support. The favorable outcomes of these networks can be upscaled in other country settings. Many governments and society organizations are working together synergistically in supporting these networks. Voice of young people must be heard by us. The leadership of young people living with HIV, young key populations, and young women is a key driver for a new wave of activism in changing the world. Leaving no one behind motivates the population to feel that they are part of the country and not left to struggle by themselves. Thus, building a universal health coverage system that leaves no one behind is a foundation for the solidarity of a nation. USC is in any country should cover comprehensive HIV services from prevention, diagnosis, treatment and care, as well as long-term care, based on the most appropriate and up-to-date technologies. We must be safe, which stand for sustainability, adequacy, fairness, and efficiency. In the COVID context, maximum efforts should be given to sustain high coverage of ART in order to prevent the emergence of variants of concerns among HIV individuals who have low immunity. The COVID pandemic has disrupted HIV-related services. This requires a rapid recovery and more resilient health systems that are ready to meet future health challenges. My dear friends and my colleagues, the Global AIDS Strategy from year 21 to 26 must be effectively translated into country actions with effective monitoring systems. Governments need to continue investment adequately on HIV/AIDS. I call upon global communities for bold political leadership to address the social injustice that make certain groups of people highly vulnerable to HIV infection and getting back on track to end AIDS by year 2030. Thank you very much.
Thank you very much. We appreciate these important words, Prime Minister. It is now my pleasure to pass the table back to Dr. Tedros.
Thank you, Meg. Your Excellency Anutin Chand Virakul, Deputy Prime Minister and Minister of Public Health of Thailand. Thank you, sir, for joining us, such a great honor. And Your Excellency Julia Iman Chanduro, Ambassador of Namibia and Chair of the UNAIDS Program Coordinating Board. Your Excellency Stephanie Seydou, French Ambassador for Global Health. And my sister Winnie Bianiema, Executive Director of UNAIDS. Excellencies, dear colleagues and friends. The global HIV pandemic has faded from the headlines, but it's not over. Far from it. On World AIDS Day, we commemorate those we have lost and commit to protecting those at risk. World AIDS Day is one day a year, but almost 38 million people around the world live with HIV every day. It has been more than 40 years since this novel virus emerged, and yet last year, an estimated 1.5 million people were newly infected with HIV, and nearly 700,000 people died from causes related to AIDS. It doesn't have to be this way. We know we can do better because we have made real progress in the 2 decades decades, years, since the United Nations General Assembly held its first special session on HIV. More than 28 million people around the world are now on antiviral therapy. 8 countries achieved the 90-90-90 targets for testing, access, and viral suppression by the end of 2020, and several countries are nearing the new 95-95-95 targets set out in Global AIDS Strategy this year. Botswana has become the latest country and the first high-burden country, as well as the first from Africa, to request WHO certification for being on the path to elimination of mother-to-child transmission of HIV. AIDS-related mortality has declined by nearly half since 2010. And yet, while we have achieved so much, we still have a long road ahead. Even before the COVID-19 pandemic hit, progress and funding for the HIV response had flat-lined. Already, many of the most at-risk populations were not being reached with HIV testing, prevention, and care services, even as these key populations also face significant stigma and discrimination. The COVID-19 pandemic has made things worse with the disruption of essential health services, including for HIV. Compounding this is the fact that people with HIV are especially vulnerable to COVID-19. At the root of the AIDS crisis is inequality. We have the tools to end the AIDS epidemic if we use them all and well. On Monday, UNAIDS issued a stark warning that if we fail to act, we will see a resurgence of up to 7.7 million AIDS-related deaths over the next 10 years. But if we can meet the targets of the Global AIDS Strategy 2021 to 2026 and commit to our WHO Global Health Sector strategies, 4.6 million lives could be saved. Let me leave you with 3 priorities for all countries. First, recommit to end HIV by making it a political and budgetary priority. That means preventing new infections, increasing access to treatment for those who need it, and fulfilling the promise to those on treatment by making sure that access to the best ARV continues without interruption. The call to action for better and safer medicines for pregnant women, which WHO and partners are launching today, is an example of how we can fulfill this promise. Second, in the face of the COVID-19 pandemic, we must restart essential health services so that everyone, everywhere has access to prevention, testing, treatment, and care for HIV and COVID-19. And third, concentrate efforts on marginalized populations that have been left behind. We owe it to those who have lost their lives to HIV and COVID-19 and those who continue to face the threat of this disease to work towards more sustainable and resilient health systems to protect our communities into the future. Ultimately, these 2 viruses and the suffering they have caused must serve as a motivation for all of us to continue striving toward this universal health coverage so that all people in all countries and communities have access to all the health services they need for all of the health threats they face. I thank you, and Meg, back to you.
Thank you very much. And I pass to my colleague, Stuart.
Thanks very much, Megan. Thank you, Dr. Tedros, for your comments today. And now let me introduce the Executive Director of UNAIDS, Winnie Byanyima, who is joining us today from Washington, D.C., where she will be taking part later in the day, as I understand it, in World AIDS Day commemorations. Winnie, I invite you to take the floor.
Can you hear me?
Loud and clear.
Good, thank you. Excellencies, the Deputy Prime Minister of Thailand, my sister, Excellency Ambassador of Namibia, Julia, my brother Tedros, Dr. Tedros, Head of Director General of WHO, my sister Ambassador Seydoux of France, all distinguished guests with us, friends and colleagues. I'm absolutely delighted to join you today on this World AIDS Day, a day that is also the third and final day of the important negotiations for the pandemics treaty at WHO across the road from us. I'm pleased that this year we, UNAIDS and WHO together are organizing this event, a moment for us to come together and highlight the urgent need to end the inequalities that drive AIDS and other pandemics around the world. Thank you again, our chair, PCB chair, Namibia, and vice chair, Thailand, for being panelists on this occasion. And also I thank civil society and even governments represented here. This year, the world agreed on a very bold plan that if leaders fulfill, will end AIDS by 2030. On Monday, we launched a report that Dr. Tedros has referred to, reflecting a stark warning. We are not yet acting fast enough to stop the AIDS pandemic. AIDS remains a pandemic, and only by moving fast to end the inequalities that drive it can we overcome it. Our new analysis shows that if we continue as we are, if we do not take the steps necessary to speed access and close inequalities in the HIV response, the world could face 7.7 million AIDS deaths over the next 10 years. Where leaders are acting boldly and together, bringing together cutting-edge science, delivering services that meet all people's needs, protecting human rights, and sustaining adequate financing, AIDS-related deaths and new infections are becoming rare. But this is only the case in some places and for some people. It isn't happening everywhere. Globally, the curves are not bending fast enough to stop the pandemic. Last year, our data showed 1.5 million new HIV infections and showed rising rates in quite a number of countries. Infections are following fault lines of inequality. For example, 6 in 7 new HIV infections among adolescents in sub-Saharan Africa are among girls, 6 in 7. Gay men and other men who have sex with men, sex workers, and people who inject drugs face 25 to 35 times greater risk, greater HIV risk worldwide. Progress in aid, which was already off track, is now under even greater strain as the COVID-19 crisis continues to rage, disrupting HIV prevention and treatment services, disrupting schooling, disrupting violence prevention programs, and more. We see from our data that the pace of HIV testing declined almost uniformly around the world. Fewer people living with HIV started treatment in 2020 in 40 out of 50 countries, reporting to UNAIDS. Harm reduction services for people who use drugs were disrupted in 65% of 130 countries we surveyed. So without the inequality fighting approach that we need to end AIDS, the world would also struggle to end the COVID-19 pandemic and would remain unprepared for the pandemics of the future. That would be profoundly dangerous for all of us. Through fighting the AIDS pandemic, we have learned a lot about what we need more of for AIDS and for all other pandemics. Here are the things we need. We urgently need sufficient community-led and community-based infrastructure as part of a strong public health system, underpinned by robust civil society accountability. This is growing, but simply not enough. We need policies to ensure fair and affordable access to science. Here we are in a crisis, as you know, from the COVID-19 vaccine apartheid. But every new technology should reach each and everyone who needs it without delay. We need to protect our health workers and expand their numbers to meet our urgent needs. And here, health workers isn't just those who work in the formal health system. It's all of those in the communities. It's all those volunteers who help us to connect the people who are underground, who cannot reach a facility to connect. All those need to be protected and supported in their important work. We must protect human rights and build trust in health systems. And let me say, we must sustain adequate financing to beat a pandemic, to beat HIV/AIDS or any other pandemic. This requires global solidarity. And I take this opportunity to thank very much our donors who have stood with us through thick and thin, even through this economic crisis, putting resources there to protect and to save lives. That is why I'm here in the United States to join President Biden at the White House to commemorate World AIDS Day. It is these 5 things that I've mentioned that will ensure we close the inequality gaps and end AIDS. But they are too often applied unevenly, are underfunded, and are underappreciated. I salute the frontline communities that have pioneered these approaches, that have shown greatest effectiveness, that have driven the momentum for change, and that are also we are using to push leaders to be bold. World leaders must work together urgently to tackle these challenges head on. We cannot be forced to choose between ending the AIDS pandemic that is raging today and preparing for the pandemics of tomorrow. The only successful approach will achieve both. As of now, we are not on track to achieve either. An AIDS death every minute, colliding pandemics, widening inequalities, that's where we are. But let's end inequalities, let's end AIDS, and then we can end all other pandemics. I thank you. And back to you, Meg.
Thank you, Winnie, for your comments. Meg, I hand to you.
Thank you. And now on this World AIDS Day, we have a special video. And I'd like to introduce this by words from Prince Harry, Duke of Sussex. On this World AIDS Day, and as a potential dangerous new COVID-19 variant has captured the global attention, a new film narrated by Prince Harry, the Duke of Sussex, and UNAIDS Executive Director Winnie Byanyima is highlighting the striking parallels between the struggles for access to HIV medicines and the inequalities in access to COVID-19 vaccines. Prince Harry, Winnie, and the People's Vaccine Alliance are sending a clear call on World AIDS Day to be courageous and working to end inequalities, end AIDS, and end pandemics. We have the privilege of screening this film for the very first time today on this occasion and on this special event. So please relay this message to your channels. It is on YouTube, and the links will be made available immediately after this meeting. So please share the video. Thank you.
The world is fighting a killer virus, and not for the first time.
The disease, which is almost always fatal, leads to a complete breakdown of the body's own natural defenses.
There are striking parallels between COVID-19 and another deadly pandemic, one that emerged 40 years ago, HIV.
Both have caused millions of deaths. And in both cases, scientific breakthroughs have meant that for many, life could begin again.
But not for all. This is a story about how corporate greed and political failure have prolonged both pandemics, and what we can do to stop it.
The inequitable distribution of vaccines is not just a moral outrage. It's also economically and epidemiologically self-defeating.
Then it was access to the first antiretroviral drugs. Now it's COVID-19 vaccines. And once again, pharmaceutical companies are making vast profits in the rich world of life-saving medical advances, while the poor are being left behind.
It is an indictment on humanity that more than 82% of the world's vaccine doses have been acquired by wealthy countries, while less than 1% has gone to low-income countries.
In the early 2000s, a wave of activism helped break drug company monopolies, giving millions of people access to generic medicines at a fraction of the price.
We are again fighting for change. Many more will die if we don't succeed.
Millions are being left behind, not because the science isn't there, but because we make choices.
Many of these vaccines were publicly funded. They are your vaccines. You paid for them.
This is a critical moment when leaders are either on the right or wrong side of history. And while some of them are listening, not much is being done.
What we need to do is lead an entirely new effort, an effort that involves working with the pharmaceutical companies and others to vastly increase supply.
By ending vaccine monopolies and sharing technology, companies in the developing world can start producing COVID vaccines too.
It's estimated that in Africa alone, up to 12 million people died needlessly in the time it took to make HIV treatment globally available.
Break the monopolies.
Share the know-how.
Deliver a people's vaccine.
Okay, thank you for that. That was a debut video and really some powerful messages within the video. We also have the privilege to have received a letter of thanks from Prince Harry, Duke of Sussex, that I would like to read to you, Dr. Tedros and Ms. Winnie, right now. Thank you. Dr. Tedros Adhanom Ghebreyesus and Ms. Winnie Byanyima, on this World AIDS Day, we recognize 40 years that have shaped the life for many. We honor those whose lives have been cut short and reaffirm our commitment to a scientific community that has worked tirelessly against this disease. My mother would be deeply grateful for everything you stand for and have accomplished. We all share that gratitude, so thank you. It is striking to now see the world's leading AIDS activists are also leading the call for COVID-19 vaccine equity. Vaccinating the world is a test to our moral character, and we are experiencing a spectacular failure when it comes to global vaccine equity. Similar to the AIDS crisis, we've yet again revealed over the past year that the value of a life depends on whether you were born and or live in a rich nation or a developing country. We've known for some time, thanks to the medical experts, that if we are unable to meet the agreed targets to vaccinate 40% of every country's population by the end of the year and 70% by next September, potentially more dangerous COVID variants like the ones we are likely to arise, and yet we are here. While it's too early to know the full extent of the risk of the Omicron variant that it will pose, we only know about this thanks to the experts in South Africa for identifying it. There is no doubt that its emergence is of deep concern. Now more than ever, the voiceless majority of the world needs to be heard. And the onus is on our leaders to end this pandemic. Anything less is self-defeating. That means breaking pharma monopolies that prevent vaccines from getting to communities around the world in need. That means governments honoring their promises and delivering the doses they committed. That means pursuing international pandemic agreements with strict timelines and holding each other accountable to them. That means treating all human lives as equal lives. It's time to draw the lessons we learned throughout the HIV/AIDS pandemic, where millions died unnecessarily due to deep inequities in access to treatment. Are we really comfortable repeating the failures of the past? Everything I've learned from youth to Sentebale tells me not. They see how repeating the mistakes is destructive and self-defeating. It is a betrayal of the next generation. Let's spend today celebrating and building on the work of champions who turned what was once a death sentence into a manageable condition. Let's spend tomorrow continuing our efforts to save lives and make a difference. From Prince Harry, the Duke of Sussex and founding patron of Sentebale. Thank you. Okay, now it is my honor to introduce the Ambassador of Namibia and the Chair of the UNAIDS Program Coordinating Board. I would like to ask Ambassador Julian Imran Chundru to deliver her keynote message.
Thank you very much, Meg. Honorable Chani Viraku, Deputy Prime Minister and Minister of Public Health of Thailand, Dr. Tedros, WHO Director General, congratulations again on the World Health Assembly special session. Madam Winnie Byanyima, Executive Director of UNAIDS, Your Excellencies, distinguished guests, colleagues and friends, may I stand on the protocol earlier established. World AIDS Day is a moment to commemorate those who we have lost to AIDS, an estimated 33 million people since AIDS was first discovered 40 years ago. It is an opportunity to show support to people living with HIV and for the people to globally unite in the fight against HIV. It is also a moment to celebrate the enormous progress that has been made in the fight against HIV. UNAIDS estimates that in 2020, about 680 people died from AIDS-related diseases, an alarming statistics that reminds us that what an emergency AIDS still is. but we can find hope that the number has come down from 1.2 million deaths decades ago. Globally, we have seen the number of people living with HIV now on life-saving antiretroviral treatment increase from 8 million in 2010 to 28 million a decade later in low and middle income countries. Even if we are still far off our collective goal to end AIDS as a public health threat by 2030, the unique global solidarity and strong political will in many countries have secured positive health outcomes for people living with HIV in comparison to 10 years ago. Namibia is grateful for this global solidarity. Given our strong political will and efforts in availing resources towards their response, in collaboration with partners, people living with HIV and communities, the national response towards AIDS, ending AIDS as a public health threat by 2030 is right on track. Dear Excellencies, ladies and gentlemen, Namibia commits to ending this dreadful AIDS pandemic by the set time. This is evident from the recent programmatic data, which shows the progress of 90, 98, 91 in the country. As chair of UNAIDS PCB, we have seen from the front row this year how critical the global leadership is, and we are proud to have been part of the Global AIDS Strategy and the 2025 targets development and adoption process. The key messages for me on this World AIDS Day are hope. AIDS remains an emergency, which we must not forget during the response to the COVID-19 pandemic, with resolve and will to address the most challenging obstacles of the AIDS response that are left. We can end AIDS by 2030. I thank you.
Thank you very much, Your Excellency. And now we're going to have a moment that's a bit lighter, and we're very, very happy to be able to introduce the one who sings, who is a musician from South Africa, formerly part of Freshly Ground, who has provided us with a special video for today. So let's listen to this wonderful musical interlude. Thank you.
Hello everyone, I am the one who sings, and it's an honor, it's a pleasure for me to speak to you today on World AIDS Day. And really my thoughts, particularly over this time of such great change globally, is my thoughts are that this is the best time to really set our intentions as a global species. This has been such a wonderful time for us to really crystallize what we want for ourselves, what we want for our countries, what we want for our species. And the area of health and the area of looking after ourselves and seeing the value in honoring ourselves and honoring others, I think is a very wonderful message to work with here on World AIDS Day. So with that in mind, I'd like to play a little song called Remember Who You Are that I wrote. If the birds up in the trees know how beautiful they are, if the mountains and the seas know how magical they are, if the stars which made our skin show how radiant they are, oh, they shine their light until you remember who you are. Oh, remember who you are. You are innocent and free. You're the dreamer waking. Oh, yes, you are. Yes, you are. You're a part of everything. Oh, yes, you are. And we will share these words until you remember who you are. Who you are. Oh, remember who you are. Who you are. Oh, remember who you are. La la.
So back to you, Stuart, to now move to the next part of our afternoon on the panel discussion.
Well, thank you very much, Meg, and thank you to the one who sings for some important messages, but more importantly, some absolutely beautiful singing. And I see all the comments in the chat about this. What a beautiful song it was, and what a beautiful voice they have. We're going to change pace just a little bit now, and we're going to bring in an amazing group of people from around the world. People with long, with varied, and with crucial engagement in the 40 years of the global AIDS response at country level and globally. We're going to ask each speaker in turn a question, and then, with time permitting, we'll open the floor for some questions from you through the chat. So let me start by introducing our first speaker, our first panelist, who is not here with us in person, will be joining us by video. I'm delighted to begin this panel discussion introducing Joyce Uoma. Joyce is here representing Y+, the Young People's Network of people living with HIV. Please welcome Joyce through a video connection.
Hello, everyone. Thank you very much for this opportunity. My name is Joyce Amonde Uoma, and I am the Influence and Engagement Advisor at the Global Network of Young People Living with HIV, commonly known as Y+ Global. On this World AIDS Day 2021, I add my voice to the call to world leaders to not only address inequalities, but to end the inequalities that affect young people globally. As we know, young people continue to bear the brunt of several inequalities. 40 years down the line, we still have young people who cannot seek essential HIV prevention, treatment, care, and support services due to the services not being youth-friendly. 40 years down the line, we're still struggling with poor healthcare provider attitudes. Young people living with HIV are still stigmatized. It is even worse for those of us who are part of the key population. Most young people do not have jobs. They are forced to incur high out-of-pocket expenditures when seeking these essential health services. At some point, young people are forced to prioritize food over health. In most countries, we still have a high age of consent, which is a huge barrier to access to services. There are many inequalities that I could mention, but these inequalities continue to compromise our treatment outcomes and generally the quality of our lives. COVID-19 has really deepened these inequalities, as it has suddenly displaced HIV as a priority. In my country, for instance, we are currently experiencing shortages of essential commodities such as ART, prevention prophylaxis, viral load reagents, and even condoms. At this point, basically, we have no commodities for HIV prevention, no commodities for monitoring, and no treatment commodities, and we have no idea when this will be resolved. This affects the whole population, but it also hits young people differently. On this World AIDS Day, I call for world leaders to end inequalities towards young people by 1. Making HIV prevention, treatment, care, and support services readily available in a youth-friendly manner to young people in all our diversity. 2. Funding youth-led organizations to lead the HIV response and improve the quality of life for young people. Finally, world leaders need to continue addressing these inequalities beyond World AIDS Day and supporting young people in all our diversity to lead the process. Thank you.
Thank you very much. It was really a wonderful presentation and a strong voice of youth. Thank you, Joyce. It's now my pleasure to introduce the second panelist on our panel, Michel Katzenstein. He needs no introduction. Professor has dedicated more than 30 years of his life fighting for AIDS and promoting global health as a physician, researcher, advocate, policymaker, diplomat, and administrator. And we're so pleased that you're here with us in person. Michel, you have vast experience in Eastern Europe and Central Asia, where we continue to see rising rates of new infections in some countries, especially amongst key populations. From your experience, what are the strategies we all need to be taking in order to end inequalities and ensure that governments and partners put in place more sustainable initiatives and response architecture to reach populations left behind? Thank you.
Thank you, Meg, and thank you for inviting me to be part of this event. You know, I must say, I always have mixed emotions on December 1st. On the one hand, the eagerness to celebrate what we as a global world have achieved in 40 years of fighting HIV, and then the anguish about the many deaths and the suffering and deaths I have witnessed for many years as an AIDS physician, but also the deaths that continue to occur despite the means of prevention and treatment we have. But thank you for raising the issue of Eastern Europe and Central Asia, the one region of the world where the rates of new HIV infections continue to increase and increase fast, basically a 30% increase in the last 10 years. An HIV epidemic that continues to spread among key affected populations, people who inject drugs, men having sex with men, sex workers, and their sexual partners, in a context of stigma, criminalization, insufficient data to guide programs, low to very low access to prevention, and access to treatment that is still below the average, the global average. An epidemic that is intertwined with the pandemics of tuberculosis, multi-drug resistant tuberculosis, hepatitis, and now, of course, COVID-19. Almost half of the new infections in the region continue to occur among people who inject drugs. And yet we know that new infections among people who inject drugs can be dramatically reduced if drug use and possession for personal use are decriminalized, and if people have access to harm reduction programs. But access to full harm reduction package of services as recommended by WHO remains very low in the region. And opioid agonist therapy, the most efficient treatment of opioid dependence, is not accessible in the Russian Federation, Uzbekistan, and remains disproportionately low as compared to the needs in most countries in the region. So you're asking which strategies to take. Primarily, I would say a strategy of patient and continuous engagement and dialogue, promoting science and evidence and advancing rights with the aim to achieve structural changes, policy and legislative reforms, promote the evidence of what works and what does not work, be it opioid agonist therapy versus conventional approaches to detox, or showing the economic benefits of implementing harm reduction versus repressive policies. Promote the science and evidence among affected communities, local government that can sometimes take remarkable initiatives on its own, and across the general public, fighting myths, false and distorted information, fighting stigma, including among healthcare personnel. Have rights, human rights, at the center of all advocacy efforts for reforms and policies as the new UNAIDS strategy calls on us to do so. engage dialogue with the criminal justice system, as UNDP has been doing by organizing 2 judges regional fora this year. Engage a repeated and uninterrupted dialogue with public health authorities, ministries of interior, prison administration, parliaments, and leadership at the highest level of government. That is what we do, you do, as UNAIDS and WHO in countries in the region and all over the world. This is what you do, Carlos, as civil society, despite a shrinking political space for non-governmental organizations in the region. This is what we have now also started doing in the region with a newly established Eastern and Central European and Central Asian Commission on Drug Policy, chaired by former President of Poland, Aleksander Kwaśniewski. It will take more time and efforts until we can overcome the structural barriers to fighting the HIV epidemic in the region. But progress is also there in every country, despite the context. And COVID has shown how remarkable the resilience of systems can be, and some remarkable initiatives to maintain access to treatment across Eastern Europe and Central Asia. Better data are now accessible on vulnerable populations thanks to organizations such as the Eurasian Harm Reduction Network, the Eurasian Coalition on Male Health, national and regional fora for sex workers. There are so many shining examples of resolute and courageous civil society and community actors across the region. And you, as UN, work as one at country and regional level. I also see younger, internationally open, and better informed political leadership accessing power in countries of the region. So I'm confident that the evidence and the fight for rights will prevail. We will end inequalities and we will AIDS in the region, and we will end AIDS everywhere across the world. Thank you.
Thank you for those encouraging words, Michelle. Thank you so much. Now it's my pleasure to introduce our third panelist today. Joining me from Bangkok is a dear friend and a longtime colleague, Midnight Pungkasawatana. Midnight's the executive director of APCOM, Asia Pacific Regional Network, working on male sexual health and LGBTIQ issues. Midnight, our question for you today is, you and APCOM, the organization that you head, you've been at the forefront of work in Asia and the Pacific around HIV, male sexual health, sexual orientation, sexual gender identity and expression, and related matters for many, many years now. In your experience, how do truly empowered communities make a difference?
Thank you so much, Stuart, for the question. And thank you very much, WHO and UNAIDS, for inviting me to this very special commemoration for World AIDS Day. Swadee krap and good evening, everyone from Bangkok, Thailand. Hope you're staying well and safe. First of all, I'm so proud to hear the speech of the Deputy Prime Minister of Thailand and Minister of Health, Kun Anutin. And thank you for your leadership for the support for key populations, young people, people with HIV, and also for community-led interventions. So it's been 40 years later for AIDS epidemic, and that still threatened the world, not because of lack of knowledge. And we know that because of structural, economic, social, cultural, and legal inequities and inequalities that obstruct the proven solutions to HIV prevention and treatment. And that, we're talking today about tackling inequalities to advance the human rights of key populations and people living with HIV, to make societies a better place and also prepare us better for tackling HIV, COVID-19, other pandemics, and other emergencies as well. As a gay man, I had a once-in-a-lifetime opportunity to address the UN General Assembly in 2016 for the high-level meeting on ending AIDS. And at that time, I said that if we want to achieve the fast-track 90-90-90 target by the year 2020, the time is actually now for urgent and increased investment in innovative regional and national approaches and programs that are led and by key populations to break down structural barriers that affect and make them vulnerable to HIV, especially for young gay men and sex with men and transgender people in our region. And then as we move ahead with the 2021 political declaration and the new global AIDS strategy with the 2025 targets, I am again calling for urgent and increased investment in innovative regional and national approaches and programs for and led by key populations. And the reason why we keep saying this from civil society is because it's so important that there should be strong commitments from member states to engage communities as partners, leaders, and beneficiaries, including allocation of resources for community organizations and for supporting community in the role to lead, not just on service delivery only, it's also in the areas of policy and advocacy engagement, quality assurance, and community mobilization. So for our region, Asian Pacific, we require 32% of the global resources needs, particularly for HIV prevention. So for ending AIDS, it will require substantial additional domestic investment, reinvigorated international contributions, more efficient allocation of available resources, and creative solutions to the reductions of the physical space that we are seeing now caused by COVID-19. I'm saying this because the community structure is so important, and the resiliency of our communities is really on the brinks at the moment, and that sustainability is not guaranteed. However, we do know that during COVID-19, it's so important that community-led responses have been able to not just quickly, but also reaching those that are most being pushed further to the margins due to the pandemic because of inequalities, and they cannot access any social safety nets. We have seen the community providing food, water, cash, shelter, refer to services, being the voice of the marginalized and raising awareness of the inequalities faced by their communities in the ground. So what do we really need then, apart from these resources? We know that from the political declaration, there are already commitments in terms of increasing the proportion of HIV services to be delivered by the communities, including that by the year 2023, community-led organizations will deliver 80% of HIV prevention services. There is commitment to building on resilience and innovations of community-based health system. There's commitment for investing in community-based emergency responses. And there's also, within the 2021 political declaration, strong language on scientific evidence demonstrating that people living with HIV who are on antiretroviral treatment and maintain an undetectable viral load do not sexually transmit HIV, or known as undetectable equals untransmittable, U equals U. So we have to really leverage this breakthrough to work towards vision of zero stigma discrimination. We have to scale up innovation. So I talk about pre-exposure prophylaxis as key components for combination prevention, the needs that for it to be available for those that require them. We need to make knowing your HIV status more accessible, including making HIV self-testing a readily available option. We need to move away from numbers and seeing the faces and the people first, rather than the numbers for reporting. I congratulate Thailand on their leadership throughout the negotiations of the political declarations and championing the language on community-led and key population-led responses, undetectable equals untransmittable, and the availability of HIV viral load testing. So for me, I just leave you with some of the recommendations of how do we tackle inequalities in Asia Pacific region. And that because of the combined effects of the COVID-19 and HIV, they're reinforcing inequalities that's already within our most marginalized communities. And it is heartening to hear the global leaders, here tonight, talking about ensuring there is a community leadership and support for that. So I'll leave you with three things: ensuring that programs uphold human rights. This includes for key populations, gay men, sex with men, sex workers, transgender people, people who inject drugs, and prisoners and other incarcerated people. They are particularly vulnerable. Secondly, ensuring equitable access to services and scaling up of new innovations, which means we must do our utmost best to reach those that we have not yet reached. And then lastly, strengthening and investing in key populations and community-led infrastructure. This includes lay providers from the community and seeing the community responses as an integral and important part of the national health systems. Thank you so much. Sawasdee krap.
Kakungkap. Thank you, Midnight, for your comments, and our congratulations as well on joining the NGO delegation as an incoming member for representing Asia on the UNAIDS Program Coordinating Board. We wish you the best with that new assignment. And now, please let me introduce our next panelist. I have the pleasure to introduce Erica Castellanos, who serves as the Director of Programs for the Global Action for Trans Equality, GATE. Erica is a transgender woman living with HIV, originally from Belize and now based in the Netherlands. Erica, lovely to see you. And the question we have for you, based on your experience, as we commemorate now 40 years of the AIDS response, how can all of us working in and around HIV better address the stigma and the discrimination that still prevents so many people from accessing services like treatment and care, especially for people most at the margins of societies, so that we can really make sure that no one is left behind in the response? Erica, to you.
Thank you, Stuart, and lovely to get the question about stigma and discrimination. I was diagnosed 26 years ago, and it was a very different place in the world. And every year when World AIDS come, I always think to myself, next year it's gonna be a better place. There's gonna be less stigma and discrimination. And every year I'm proven wrong. And you know why I'm proven wrong? Because we have like this negative association from the beginning with HIV. And we've always associated with certain people or with key populations, or we associated with sex, like if sex was something bad. And the thing is, like, you know, I put the U equals U message as my screen there because it's the same thing that is happening with U equals U. We have the evidence, we have the science, but because people think, oh, it's all about having sex without condoms, and they, you know, they want to discard such a powerful message. I remember years ago, one of the biggest fears I've had in my life is I don't want to start a relationship because I don't want to pass on HIV to anyone. That fear has been eradicated. I have a husband, we have 2 lovely children. And that's because of powerful messages like U equals U. But the issue is stigma and discrimination has other underlying problems that are not addressed. We're always trying to address the symptoms in HIV. And I want to call on everybody today, let's stop addressing the symptoms and let's tackle the root causes. What makes us vulnerable to HIV? It is not because I'm trans that makes me vulnerable to HIV. What made me vulnerable to HIV is because we live in countries that don't respect us, that don't even recognize our existence, that criminalize us for who we are, for who we love, for what we do. And until we tackle the root causes of what makes us vulnerable, we will always be chasing our tails in the HIV response. So I call everyone, let's take action. And in this, to do this, we need to prioritize communities. You know, the World AIDS Day team calls about ending inequalities and, you know, how do we reach people left behind? Well, we need to prioritize communities, give us the respect, recognition we deserve, and acknowledge our lived expertise. We need to address issues like criminalization. Sometimes we think of the concept people left behind, like if there's this abstract agent or extraterrestrial body responsible for leaving us behind. No, it is our direct actions. It is the actions of the states, of the gatekeepers that leave us behind. It is the inaction of those of us that look the other way and think, oh, this is not my problem. And it is the fear that we don't dare engage in difficult and challenging issues. That is what is leaving us behind. That is what is killing us. And simple things, words matter. When we are talking about people, We must name people, we must call on people, communities, we must engage with communities by how communities identify. We can only end inequalities and stigma and discrimination if we actually recognize who we're trying to protect and address as human beings, and not just as a statistic and a number that goes in our reports, especially in World AIDS Day. So the call to action is stop looking at us like numbers. We are human beings just like you. Thank you, Stuart.
Erica, thank you so much. And thank you also for the time that you have spent as a member of the NGO delegation to the UNAIDS Program Coordination Board. Very much appreciated. Meg, let me bring you back. We have such a vigorous chat going on in the chat. I wonder if there is maybe one question that we should pick up on before we carry on. Meg?
Stuart, I first would like to, before we go to Q&A, introduce Dr. Ibtisam, Dr. Khoudry, chef de service de maladies sexuellement transmissibles et de la sida à la direction épidémiologie et de la lutte contre les maladies dans le ministre de Santé de Maroc. Donc, we have one more speaker to go before we take questions. So we're very delighted to have Dr. Khoudry with us today as a representative from North African region and as a NAC manager in Morocco. Donc, je vais changer jusqu'à français pour la traduction. Docteur, est-ce que vous pouvez nous parler du rôle et responsabilités du gouvernement dans la lutte contre les inégalités et en matière d'accès aux services de soins de VIH, surtout par les populations clés et vulnérables? Merci.
First of all, thank you very much for invitation. I'm really pleased to be part about during this important meeting. I want to thank first UNAIDS and WHO for the organization of this meeting. So I will be very brief and talk about the achievements of Morocco to end the inequalities and end AIDS, especially for key populations. First of all, Morocco is a low prevalence country. Prevalence is estimated around 0.08%. And this prevalence, of course, is much higher among key populations, as IBBS studies that we have conducted in Morocco show that this prevalence may reach, for example, 7% among PWIDs. Morocco has also extended during the last years its offer for care for HIV in order that to make the services really approximate for key populations and also other people affected by HIV. With regard to the national cascade for 2020, Morocco has reached the second and third 90, and the challenge is now to reach the first 90 and come to elimination for HIV for the next years. We have reached in 2080 81% for the first 90 and the 92% and 92% also for the second and third 90. And for the situation is quite different if we compare females with male, and because for female we have already reached the 390s in 2080 and in 2020, sorry, and much efforts need to be held in order to make the first 90 reachable for men also. For that, we have elaborated a national strategy for screening in order to accelerate the first 90, and we are focusing really on for the next period for index testing, for multi-disease campaigns in order to target more men, and also extension of community testing, and also extension of self-test and auto-test for general population, and also, of course, K populations. We work under a national strategic plan for the next period, and we work also in order to reduce new infections and mortality by 50%, and we also focusing on interventions to reduce stigma and discrimination for people living with HIV and K population, and there also a national strategy that we have elaborated for human rights and HIV. If I can really quickly talk about the main realizations and achievements in the past years, we can say that the service prevention and harm reduction have been extended all over the country with the help and the coordination with civil society. We have also introduced PrEP for K populations, and also we have implemented community testing for K population, and also piloting a very interesting experience to introduce auto test, and we are now moving on task shifting in order to involve also civil society and other sectors like private sector in order to extend care services for K populations and also people living for HIV. And also we have raised the challenge of COVID-19 pandemic, and we have maintained services of care for people living with HIV in collaboration with civil society, and that's it. So at the end, I would like to thank really UNAIDS and to the WHO and also Government Fund for their partnership, and also civil society and all government partners for the partnerships. Thank you very much.
Thank you very much for giving us an insight of the work that you're doing, and it sounds so important in Morocco. So thank you very much. I think because of where we are in our agenda, we've been seeing such an active discussion in the chat. I think we will pass on Q&A and move to our final speaker before we move into the candle lighting process. From Ambassador Stephanie Sedouy. Ambassador Sedouy has been appointed the French ambassador for global health in 2018 and has been very instrumental and very active in the work of UNAIDS and the joint program, and really championing for West and Central Africa that we can really change the direction of our HIV trajectory in that region of the world. So our question to you would be, please provide reflections on what you have heard today during the panel discussion. What do you believe are the most critical elements to overcome the inequalities to reach our targets of ending AIDS as a public health threat by 2030? Thank you.
Merci beaucoup. Je vais m'exprimer en français si vous m'y autorisez. C'est un vrai plaisir et un honneur d'être invitée à cet événement. Un grand merci à vous, Madame la directrice exécutive, chère Winnie, également au Dr Tedros, bien sûr, le directeur général de l'OMS, le ministre de la Santé de Thaïlande, l'ambassadrice de Namibie et tous les amis de la cause de la lutte contre le sida présents dans ce panel, Joyce, Michel Kazachkin, Midnight, Erika, que j'ai grand plaisir à retrouver, et la docteure Koudry. Merci pour votre question. Moi, je suis encore, voilà, comme à chaque fois, très secouée par et émue par l'importance de ce qui vient d'être dit. Ce sont des témoignages très forts que vous avez mis en avant pendant ce panel, et on a aussi entendu des éléments de politique très, très fort également de la part de la docteure Koudry, par exemple, avec l'exemple du Maroc, ou également Michel Kazatchkine pour la stratégie sur l'Europe de l'Est. Et je pense que peut-être en ouverture de quelques éléments de réflexion que je me propose de vous donner, peut-être dire que ce qu'a dit ce panel en cette journée majeure de lutte contre le sida et le VIH, 1er décembre, hein, c'est un 40e anniversaire qui est important, c'est que quand on parle de VIH-sida, on ne parle pas de maladie. Ça n'est pas une approche sanitaire au sens strict, ça n'est pas une approche médicale au sens strict, même si bien sûr cette dimension est cruciale et le rôle des innovations biomédicales et le rôle bien sûr de l'accès à ces innovations est majeur. Mais on ne parle pas d'une maladie, on parle vraiment d'un sujet de société, un sujet d'humanité et un sujet qui implique des individus et des êtres humains. Et je pense que cette dimension qui a été très présente d'emblée dans la lutte contre le VIH, qui d'ailleurs donne toute sa signification politique à cet engagement, est aujourd'hui plus que jamais d'actualité, aujourd'hui avec le défi supplémentaire que pose à l'humanité la crise de la pandémie du Covid-19 et aujourd'hui aussi, s'agissant de la lutte contre le sida, avec le défi que nous avons de nous dire 40 ans après, où en sommes-nous de la mobilisation sans précédent qui, bien heureusement, s'est déclenchée pour lutter à la bonne échelle et avec les bons instruments contre cette menace contre l'humanité qu'était l'épidémie du VIH-Sida. Et je suis très émue aussi de voir combien dans les débats, on voit apparaître la pertinence de l'instrument que ONU-SIDA a mis sur la table et qui est cette stratégie renouvelée, cette stratégie 2021-2026, avec son accent sur les inégalités. Et je pense que le focus de la stratégie qui a permis aux partenariats autour d'ONU-SIDA de vraiment se mobiliser pour mettre sur la table la bonne proposition. Et effectivement, l'angle qui permet de vraiment faire levier pour mobiliser toute la dimension sociale, politique, le point de vue bien sûr des communautés, à l'appui des interventions d'ordre plus médical, de manière à pouvoir avancer dans la lutte contre cette pandémie et plus largement dans la lutte pour une meilleure santé pour tous. Voilà peut-être le point que je voulais faire. J'aimerais revenir peut-être avant de céder quand même la parole aux questions et réponses si on a un petit peu de temps, parce que je pense que c'est très important de rester participatif. Mais vous remercier à nouveau aussi, chère Winnie, pour l'invitation que vous avez faite à l'ensemble de la communauté de lutte contre le VIH à venir à Dakar il y a quelques semaines pour justement mettre en évidence l'importance de la mobilisation de la société civile et des communautés sur la région Afrique de l'Ouest et du Centre. Mais je pense que la richesse des débats serait certainement à une signification qui dépasse cette région, même si c'était très important d'entendre les acteurs de la région s'exprimer. D'emblée, le pays hôte, en la personne du président Macky Sall, s'est engagé avec 2 milliards de francs CFA pour soutenir plus les communautés, et l'importance de leur rôle a pu être mise en avant, y compris la valeur financière de leurs interventions, c'est-à-dire toute une série de propositions pour permettre de mieux financer, de mieux soutenir matériellement les interventions de ces acteurs. Et c'était, je crois, un moment très, très important, alors même que nous sommes encore dans la lutte contre la pandémie du Covid-19, de se retrouver pour surtout mettre en avant un message aussi fort. J'aimerais terminer en disant qu'en ce jour du 1er décembre, nous sommes aussi à l'orée d'une année qui sera une année importante dans la lutte contre le VIH, avec la reconstitution des ressources du Fonds mondial sous l'égide des États-Unis, que qu'on remercie. C'est d'autant plus important qu'une stratégie aussi puissante que celle de ONU-SIDA puisse accompagner le plaidoyer qui sera fait pour cette mobilisation de ressources. Et j'aimerais enfin rappeler qu'on a, pour la lutte contre le VIH-SIDA, l'occasion aussi de profiter d'un élan renouvelé du fait de l'effort multilatéral de lutte contre la pandémie du Covid-19, un nouvel enjeu qui s'est fait jour pour justement permettre que l'accès à toutes les ressources biomédicales reste un sujet politiquement très porté. Je mets une petite casquette française pour dire que de ce point de vue, la France s'est beaucoup mobilisée pour que le sujet de l'accès, y compris aux capacités de production, fasse l'objet d'un effort international appuyé. Et via notre partenariat de longue date avec United et le Medicine Patent Pool, nous soutenons fortement l'augmentation rapide des capacités de production sur l'ensemble des continents et en particulier en Afrique pour la production rapide de vaccins contre le Covid-19, mais surtout dans une optique plus large, y compris de renforcement de capacités de production à l'échelle de la planète, qui pourrait également aider dans les combats contre les autres grandes pandémies, dont celle du VIH-Sida. Avant de rendre la parole, est-ce que je peux me permettre de dire que j'ai été encore une fois très secouée par le témoignage de Erika, que je connais bien. Nous sommes souvent dans les cercles, notamment au Fonds mondial. Quand elle dit dans la stigmatisation et quand elle rappelle l'importance de mettre les choses et de donner leur nom aux choses, et quand elle dit il y a toujours ce soupçon, il y a toujours ce rejet avec cette vision suivant laquelle le sexe est une mauvaise chose, the sex is bad, et que ça fait partie des choses qui ont contribué à rendre socialement si difficile la lutte contre le VIH-Sida. Je trouve que c'est tellement important qu'on ait aujourd'hui encore, en 2021, des personnalités comme Erika, comme Midnight, comme d'autres, qui sont capables de prendre la parole pour dire ce genre de choses et pour nous secouer tous à titre individuel, mais aussi bien sûr à titre professionnel. Et je voudrais encore une fois vous remercier de l'occasion donnée collectivement pour prendre le temps de se rappeler qu'est-ce que c'est que ce combat dans lequel nous sommes tous si passionnément engagés, en espérant qu'on aura à nouveau de grands succès à notre crédit dans l'année à venir. Merci beaucoup.
Thank you. Now back to Stuart.
Thanks very much, and thank you, Ambassador. Thank you, Meg. Well, before we move on, I just want to recognize so much of the chat going on. So many people pointing out the disparities, the inequalities that still exist in our AIDS responses around the world. And as someone who's been involved in the AIDS fight for so many years, as a person living with HIV since the 1980s, it's sad to see that so many of the things we've talked about for so many years are still issues. But then we see so much excitement too. I note the trending conversation around PrEP, for example, and the fact that we have technologies, we have the things, the tools that can be game changers, yet we're not getting them to people. There was one particular comment that struck me that said we have the evidence we need, and we need to make PrEP as available and as accessible as condoms are, and digital health interventions that go a long way. These are cost effective, and they're tools that we know that work. We have a long way to go. Now, let me introduce a video. A very interesting young man, 32 years old, young for me, Jonathan Montoya. Jonathan is seeking to become the first person from Mexico to complete the Seven Wonders Walk. traveling the world on foot, following the route of the seven wonders. And well, you might ask what his mission is. It's to dive deeper into his own body, into his own mind and spirit, while raising awareness and funds for HIV-related work while on his journey. We have a message from this amazing young activist who started walking on the 7th of July and who extraordinarily will be walking for the next 7 years. Let's watch Jonathan's journey.
Hello, I'm Jonathan Montoya, and I decided to walk around the world for AIDS. I got tested for HIV for the first time when I was 15 years old, and I got tested compulsively during my adolescence until one day, on my 20th birthday, I simply stopped having sex. That went on for over a year. But the celibacy itself wasn't the issue. The real issue was that, as a young gay man, I grew so scared about HIV that I renounced pleasure, and in many ways I renounced life. You see, I had such oppressive sexual education growing up that did not allow me to develop the skills to face my realities in a different way. I'm an adventurer. I have a lust for life, but at the same time there has been moments where I have been truly afraid of living. For that reason, more than once, I made an attempt on my own life. But that's the old me. Today, thanks to you and the ones that came before you that never gave up, I'm doing this to contribute building a world where no one lives in fear of living. Where comprehensive sexual education is available for all, and where AIDS is no longer the destiny for any gay man, trans person, or sex worker. Over the next following years, I'm going to be championing the ambitious and very inspiring 2030 Global AIDS Strategy by walking 25,000 miles across the world, following the route of the new 7 wonders from Mexico to China as an act of activism and an homage to you, the ones that have spent 4 decades working for a better world where health and sexual health are accessible for key populations and for the most vulnerable ones, in particular for girls and women. Let us work together to make life in this world less scary and more fair for young people living with HIV, for trans persons, for gay men, and for all those beautiful minorities living in fear around the world today. I am here because of you. To this day, I have walked over 2,000 miles in 150 days, learning from the experts, from activists and their communities, the best way to walk in life. With a cause. I'm heading to Belize next month and later on to Central and South America, and I'm looking forward to work with you. Your courage to continue the fight is contagious. Let us be bold. Let us infect our leaders with our spirit, because what we need today is a pandemic of courage.
Indeed, a pandemic of courage. That is indeed what we need. Please thank what a brave and wonderful young man. I think we can all have hope that maybe we can get to the end of AIDS as a public health threat by 2030 when we have such inspirational people in the world. Let me now introduce a dear colleague of mine at UNAIDS and another inspirational person, Carlos Garcia de Leon Moreno, also from Mexico. Carlos leads UN+, which is the United Nations support network for UN staff living with HIV. And as Carlos joins us, I ask everyone who's able to please turn on your cameras so we can join Carlos in lighting a candle in memory of all those we've lost to the AIDS pandemic, but also to shine light on the path ahead, the path that Jonathan just talked about as we all collectively work to bring about the end of AIDS. Carlos, welcome.
Thank you very much. Thank you very much, Stuart, and thank you very much to all of you. I'm sure that all of us has close to our heart a friend, a picture of a woman or a man. That could be your husband, your daughter, your father, your partner, who passed away because of AIDS. Lighting a candle is our way to honor the life of those that pass away because AIDS. It's a way to bring their passion of life, to remember their stories, and it's our way to honor the life of activists, women, trans persons, and men from all around the world for their commitment. The light of this candle can also guide us to achieve the commitment we have made, and we will going to be accountable for that. Lighting this candle is also the opportunity to commemorate life and make the effort that so many people have made before be worth it. Finally, it also allows us to dedicate our work to those who have left, to ensure that no one else must die for this cause. It's a long way to achieve that goals. It's a long way to be there. We have 40 years working for that, and we need to have courage. And as Jonathan Montoya shared with us, we need to make this a passion, some kind of a new pandemic. Let's take a minute of silence for our personal thoughts, and thank you for being here to lighting this candle with all of us.
Okay, thank you very much, Carlos. And really, I think all of us at this moment think about the people we've lost. This year has been really a tough year for many of us working in the field of HIV and AIDS, many of us working in our departments. We've lost family members for COVID or for other issues, but we also have remember back to when we first were motivated about spending our lives and putting our passion into HIV. And for me, that's more than 35 years ago. So I think it's about that we really need to cultivate that memory and keeping it alive. And that's what this candle means to me. So thank you very much. And I think we've had a very successful commemoration, and we're close to closing. So Stuart, any last words? Before, I'd like to pass over to Tim Martineau, who will be closing out our session this afternoon. Stuart?
Thank you very much, Meg. And Carlos, thank you very much for your words and for reminding us that this is a day when we remember that so many of our friends and loved ones and colleagues and committed people to HIV. Thank you everyone for joining us, and please, Tim, I give you the floor.
Good. Thank you to everybody who's joined the event. I've been watching both the number of participants and as well as the chat, and thank you for the great contributions and thoughts and for being with us. There's some good points of being in a virtual world and the opportunity for everybody to come together in this way, which is really quite unique and different. I want to just to reflect really Michelle Kazachkin's words around the sort of the mixed emotions on a day like this around celebrating success in life, but also a day to recognize the pain and loss of life and what has happened over the last 40 years. So I wanted just to really close, really to try and bring perhaps two thoughts together. One was the fantastic expression of pandemic of courage, which I just think is exceptionally strong and powerful, and combine that with this principle of addressing inequality and a sense of common purpose that we have through our strategy that we must all come together and work towards. And this has been a marvelous day to think about that. So I'm just going to really sort of thank. I can see Winnie's still there, and Tedros, who was with us, the ambassador is here, the Deputy Prime Minister, has also had to leave. But thank you for your contributions and for being with us. Thank you to Stuart and Meg for moderating the session. Thanks to Carlos for leading us for the candle lighting ceremony. I'd also really like to just thank Anne-Claire and Fernanda for their hard work. Well, I'm sure there was with colleagues in WHO whose names I don't know, who also really helped to bring this together, because it was quite a challenge to do so. And thank you everybody for doing that, including our good translators. And I wish everybody a good afternoon or evening in different parts of the world. And thank you.